Okay, well, I think we're going to go ahead and get started. Welcome everybody to our G.R.O.W community call for the month of April. We are excited today because we do have a special guest from Tri-County Health Department with some updates on current state COVID-19 pandemic and some great information for you all. We also have our early learning consultants on the call today. And I think we're going to go ahead and let you all know that we will have a Google Doc in the chat box. So you can go ahead and fill that out. Make sure you fill that out so you can get credit for being on this call today. We will then send you a certificate. We also have a door prize at the end of the call. So please make sure you stay on so you could hopefully win that awesome learning tool. And we're gonna go ahead and update everybody on our professional development opportunities. And Sarah Frenzel, will you go ahead and share that with everybody?
I would be delighted. Okay, so just as you're on today, we have a G.R.O.W call the second Tuesday of each month from 1 to 2. Our next Shining Bright is June 5th from 9 to 12. And we have an awesome Cooking Matters presentation that's going to support you in providing smart food choices for the children that we care for and communicating with families on these smart choices. If you want to access our PD calendar for any other opportunities between April and June, Holly's going to put a link in the chat box for that PD calendar. There's just a little caveat there. We have a temporary pause on the PD survey. So that has been paused temporarily whilst we figure out some glitches we have in that. And then also, this is a really fabulous opportunity. UCCS will begin offering an MA in special education beginning this fall. This actually can lead you to getting a teaching license for the state of Colorado in special education, early education, and early special education. So if you're interested in that, that link is also going in the chat box. And then the one last thing I want to add is I've had a lot of questions about EQIT. We are finishing up our cohorts. We will be completing middle of May. And we will have 3 new opportunities beginning towards the end of August. So that information will go on the website. If you have reached out to me because you need a slot in August, you will definitely get the priority invite to register for that. So just know, if you know you've got someone who needs it in August, shoot me an email. I'll get you on a list. You get about 24 to 48 hours to register before it opens up to the whole of the state. I think that's all I have. Did I miss anything, Holly or Randy?
I don't think so. I think that was everything. And so I did go ahead and add the Google Doc for the attendance sheet into the chat box for the PD calendar and for the UCCS grad program. So please let me know if you're having any issues opening up those links.
Okay, thank you, ladies. We're going to go ahead and get started. Our special guest today is Skylar Everingham. She is the Senior Environmental Health Specialist from Tri-County Health Department, and I believe she has a PowerPoint to share with us today. Take it away, Skylar.
All right, are you guys seeing the PowerPoint? All right. So once again, I'm Skylar. I've been around Tri-County for about 6 years. Most of you will know me as a health inspector, as opposed to my environmental health specialist title. I think the big plug today is we have a small dedicated team that is dedicated solely to childcare, and questions regarding childcare should be emailed to that childcare@tchd.org. That'll be the easiest way to get a hold of the team. You may also call our call center, but that might take a little bit longer for that information to get to us and for us to respond to you. Today we have a pretty packed agenda, so I'm going to try to be pretty quick about some of this information. Like I said, I'm going to try to leave some time for some questions and answers at the end, but if I don't get to it, there is that email for you to use, and we're going to go ahead and get started. This right here is a nice little, oops, hit too soon, is a nice little slide that talks a little bit about our cases in Tri-County. So you can see as of January 2020, our total cases are there at the top. You may also look at this graph right here and kind of see where we were and where we have been and kind of where we are right now. So beginning of last year, we had that blip where we did a lot of shutdowns, unfortunately. And then again in July, we saw another little blip. And then we got into those winter months where we had a whole huge spike in cases. Luckily, that has gone down quite a bit, not quite where we were last year, unfortunately. And currently, we are seeing those numbers going back up. CDPHE has a nice little map that kind of shows where some of those outbreaks are occurring. This is public knowledge, so you could go and look at that link down below and see what's happening in your neck of the woods. As you can tell, as you get closer to the city where things are more population dense, we do see a lot more outbreaks. And as we go out towards the plains, there are still outbreaks occurring, but maybe at a lesser rate. This slide might look familiar if you were on that Healthy Childcare Colorado meeting. I kind of stole it, so sorry CDPHE, but I do think it's a really great graphic that kind of shows childcare outbreaks that have been reported to us by month. So you could see it kind of followed that same trend as the cases slide where things really spiked up there in the fall, winter months. And we are still getting a fairly decent amount of outbreaks being reported to us at this point in time. And once again, this might be another familiar slide, but same pattern, right? We saw that big, huge spike happening in the winter, and we're still seeing cases being reported. What's really interesting about this slide is that we see that the number of staph cases has actually gone quite a bit down, which is what we think is a result of the vaccine. So these vaccination rates are hopefully helping us kind of get rid of some of these cases. This is also on our dashboard, but you can see that we have reached about 40% of our 3 counties as of yesterday, and that vaccine rates are going up, except for maybe that small blip in March where we had that big, huge blizzard, making it really hard for vaccines to be delivered from our hubs to providers and for people to drive over from providers to the clinics to get their shots. This right here was a little analogy that I thought of. Basically, you know, when you were a kid and it was sunny outside and you're playing with your friend and your friend looks at you and they're smiling and they're like, hey, I'm gonna race you to that tree. And you look at your friend and you're feeling real good and you got your fast shoes on and maybe you had some Cheerios and you say, you know what? I'm gonna give you a 10-second head start. Well, that's what the vaccine is doing for your immune system, giving it a 10-second head start, which basically means that people that might have once died from COVID, now they might only end up hospitalized. Other people that would have been hospitalized, maybe now they only have a mild case of COVID. People that were mild symptoms before, now maybe they're not going to have any. So this vaccine really is a chance to give your body a 10-second head start against this virus. We do know that these vaccines are not 100%. They aren't going to fully protect everyone. You've probably seen in the news that there are some people that do get the vaccine and then they do have what we call a breakthrough case. This is normal. This happens with all vaccines and it's happening at an expected rate. So that's just something to be aware of. Something else that's on our radar are these variants. So as you can see, these variants are on the rise. They're becoming more and more dominant. Right now in Colorado, our UK, or the B117, and our California, which is the 427 and the 429, have become the dominant strain, being about 57%. The problem with these variants is that they are more transmissible. They might cause more severe disease outcomes, and they may be more effective against children. The science is still being developed and examining these questions. So we will obviously be monitoring these very, very closely. The biggest concern right now is our vaccine going to be effective against these variants? We think yes. We think that some of these vaccines only change the shape a little bit, which means our vaccines will probably still recognize them. But some of the bigger changes to these viruses might make it harder and harder and harder for our vaccines to recognize them. So you might see some stuff in the news about booster shots being in the works. I don't have much more details on that, but you might see that in the news. For the governor's office, he did go ahead and update that mask order. That basically says that people ages 11 and older are required to wear them in certain settings. And those settings do include our preschool through 12 schools, our child cares, and our children's camps. And those same exemptions for not wearing a mask are still in place. So, you know, if you have a medical exemption, if you're eating, if you're sleeping, etc. And then the third component that was major in his updates was that counties that have this 1 week disease incident rate of 35 or less, which is formerly known as level green, or maybe less formally known, they may lift or modify those face covering requirements. So if you're looking at this map as of, I think I grabbed it sometime late last week, you can see a lot of our eastern plains are still in that green area and maybe some of the mountain communities. But over here in our front range, we're still kind of in those yellow and blue areas. So we still need to be wearing those masks at the state level. And then more locally, we also updated our masking order, which allows us to be more restrictive, but not less restrictive than the state. But these face coverings are no longer required to be worn in outdoor public spaces. And anyone over 10 years old needs to be wearing them in the public indoor spaces, regardless of where we're at in the dial. We're still encouraging children between 2 and 10 years old to wear those face coverings in accordance with the CDC guidance and with supervision. Here's a resource that you guys may or may not have heard of yet. It's called the Healthy Childcare Colorado Mask Booklet. It's an awesome resource. They have songs and things that make wearing a mask for children a little bit more approachable. So when you have a moment, please check that out. Here is a review for our cleaning, rinsing, and disinfecting. So our cleaning is our first step. It lets us get rid of any sticky fingers or crumbs or films that might be on a surface. It also might weaken or damage any virus particles. Then we would go ahead and rinse that surface with plain water. That gets rid of any excess soap. And then our third step is to disinfect. And this right here uses a chemical product that goes ahead and kills any of those germs that are remaining on that surface. If you're looking for COVID effective products, you're going to want to Google List N on the EPA website. And we got to remember that these are still being used in childcare. So not only would you look for that List N, but you need to make sure that they meet the regulations for use in childcares. If you do have questions, please reach out to us. And then we also saw that we have some CDC disinfecting updates. So this right here just says, hey, make sure you're cleaning. So that's the soap and water, right? Of the high touch surfaces, so pens and desks and light switches and all those goodies. And then maybe think about cleaning and disinfecting high touch surfaces if you've had a case within the last 24 hours. You're in a place where the disease is rampant. People are not wearing masks like maybe they should be. We're not washing hands. Hopefully you are in a childcare. And if you have anybody that's at an increased risk for severe illness, maybe look at cleaning and disinfecting more frequently. We recently put together a handout on these emerging devices. So we have two types. We have devices and applicators. So devices use a physical means to destroy a virus, whereas applicators use a chemical means. So when it comes to our devices, those physical ones, such as our UV devices or ozone devices, the way the EPA regulates these is they make sure, hey, that really is ozone coming out of that device. Cool, now it has the EPA number. And then they don't really test it on anything else. They're not looking at different surfaces or different conditions. They say it does what it says it's going to do and they call it good unless they have a complaint. As far as applicators go, those are those chemical means. So they're electrostatic sprayers, our foggers, our misters. Those will take your chemical product and put them at different droplet sizes to cover surfaces. The main message here is that we want to make sure that you guys are using caution when you purchase them. Make sure you really are purchasing something that is legal, has been examined, and that you're using the product appropriately. You could see this guy down here in the corner. He kind of looks like he's dancing while he's applying some probably electric static sprayer or something. But look at him. He is fully decked out. He has a full-on suit. He has gloves. He has a face mask. And this product might require all of those things to use it appropriately. We've had some conversations with some people that have been using these products, maybe without reading all of these labels and not realizing that they're not appropriately suited up to be applying them. And now they're talking about having some respiratory distress. They're finding it difficult to breathe. So make sure that you're reading everything and that you're very knowledgeable before purchasing these products. Once again, if you have questions, there's that email. More than happy to help you navigate those. We're coming up on these summer months. I know everybody's interested in traveling. So here's a little plug on what to do if you're traveling within the United States. If you're vaccinated, it kind of knocks down a couple of those requirements. If you're not vaccinated, you're going to have a few more steps before you can safely travel. And then here's for international travel. Once again, not vaccinated and fully vaccinated. In order to come back to the US, there is some mandatory testing requirements before you're allowed to jump on a plane or a boat and get back to the States. Everybody that travels should be monitoring themselves for symptoms and then wearing a mask during travel. That actually is a requirement. So if you're on a plane or a boat or a bus or any of those types of things, you are required to wear a mask under the CDC travel advisory. And it's the same for the transportation hubs. So if you're at an airport or a bus depot, you also must wear a mask. This right here was blasted out by our CDHS partners. Just kind of talks about what that expectation looks like if you're going to have visitors at your center and what level of visitors you're allowed under what level of the dial. We're still encouraging people to do virtual visits where they can. Obviously, a sick person can infect you if they don't ever see you. That's just how it goes. So, also on this document, they talked about some responsibilities as a facility and as a visitor, and there's some crossover between the two. But you know, trying to make sure that your visitors are fully vaccinated, that you're continuing those screenings, you're keeping records, you're limiting their access to hopefully one area, maybe only a couple areas. And you're following all those COVID mitigation strategies that you already know and are very, very familiar with. And then as a visitor, you know, making sure, hey, I'm checking that map, making sure that I'm not visiting a place that's in an outbreak, making sure I'm keeping records of where and when I'm at these facilities, and only limiting to one facility per day. So, you know, if I'm a facility and I'm getting into chatting with this visitor and they're like, oh yeah, I was just at, you know, Childcare ABC up the road, and you're paying attention to that map and you're like, hey, aren't they in an outbreak? That might be a good chance for you to say, you know what, we don't want your visitation today, thank you. And then once again, while they're on site, making sure they follow all those strategies. And you're going to want to make sure that there is some very clear communication between you as a facility and your visitors. So if in either situation someone tests positive, you guys are notifying them and they're notifying you and saying, hey, we have a positive situation. All right, some stuff that's kind of coming down the pipe and is also kind of already here. You probably heard in the news, the governor is going to dissolve the dial, which basically means, hey, it's no longer a requirement at the state level, but the local public health agencies can adopt it for use. So we proposed it to our Board of Health last week. And we also had meetings throughout last week with each of the county commissioners about what those plans look like. These were adopted by our Board of Health and released last Friday. And starting on this Friday, they will go into effect, but this gives some counties and municipalities the chance to opt out of these orders. We will be taking every county from yellow to blue for the next 30 days after the order goes in effect. This basically will increase capacities for a lot of sectors. Childcares, you're probably not as affected. But the 6-foot rule is still in effect. So even though you might be at 100% capacity, you still might see some limitations on how many people can fit at a 6-foot distance. After these 30 days, everybody will move to level clear for 3 months. This is a no dial restriction. We're going to make sure that we continue keeping our eye on things, make sure that our hospitals and resources are protected. And if at any point our hospital capacities are breached, we can pull these counties back into the dial. I was hoping that I would have a better update for our camps, our summer camps and our resident camps. I know that a whole bunch of stuff went to the governor's policy group, but hasn't come out yet. So stay tuned. We do have a newsletter. We plan on blasting out that information once it becomes more clear. Oops. You've probably heard about the Johnson & Johnson vaccine being paused. The Advisory Committee for Immunization Practices will be holding an emergency meeting to review the reports of 6 individuals who did get a rare and severe blood clot after receiving the vaccine. Now that's 6 individuals out of about 7 million doses of Johnson & Johnson distributed. So very, very low rate of people. But one thing we wanted to make sure is that we bought time to ensure that our doctors were aware and that they could respond accordingly. This being a rare and severe blood clot issue, I guess the protocols to handle it are a little bit different. And then as of today, we made sure that we followed suit with the FDA and the CDC and have asked providers to stop administering the Johnson & Johnson. Those that have received the vaccine more than a month ago are at a very low risk for this serious side effect. But if you've received it within the last 3 weeks, make sure that you're monitoring for any severe headaches, abdominal pains, leg pain, shortness of breath, and contact your healthcare provider. Since these symptoms are very different than the flu-like symptoms you probably would have experienced just under the COVID-19 vaccine. We are seeing an increase in norovirus and GI illnesses, especially in the last week. There have been 8 outbreaks. So we know that children get norovirus and they transmit it pretty easily. And since it's highly contagious, we need to make sure that we're on the lookout for it. So anything with those vomiting, diarrhea, fever, cramps, nausea, headache, body aches, and chills, make sure that we're being on the lookout from that. And then remember, it spreads from person to person after touching a contaminated surface and then putting those fingers in your mouth. And then make sure that we continue with our screening, hand washing, and disinfecting. And then, this is stuff that you guys have been doing all along. This combating illness is not new to you. So stay home when sick. The masking and the social distancing might have been new last year, but I think y'all are pros at it now. Avoid touching eyes, noses, and mouths, coughs and sneeze into your arms, and hand washing. And hopefully that right there will help mitigate some of those illnesses. And then last but not least, I just wanted to say thank you. I know this last year has been so difficult. It's been full of frustration and despair and, you know, all of the emotions. So I just wanted to take a moment and say thank you. And that is all I have.
Okay. Shaylee, do we have any questions?
Nope, nothing in the chat box.
Yeah, if you all have any questions, now would be the time to ask. You can unmute yourself and ask the question, or put it in the chat box. I actually have a question, Skylar. Do we know the percentage of childcare providers who have been vaccinated or who have been offered? And do we know if they're still able, or are they having a hard time still getting the vaccination?
You know, I wish that I had that number at my fingertips. I do not know the percentage of childcare vaccines that have been administered. I do know that we had some tri-county clinics that were privatized towards childcare solely, and those went really well. I also know that Children's Hospital has partnered up with CDHS to help people find vaccine. It's been a while in our email inbox since I've had someone say, hey, I can't find anything. I've tried. So I think we've reached saturation with this particular population.
Well, that's good to hear. Most of the programs that I've been talking to, they have had at least half of their staff get vaccinated or had begun to get the initial vaccination.
That's excellent news.
So there is one that just came up. If a staff does international travel and has 2 doses of COVID vaccine, what are the protocols? Do they need to quarantine?
So people that have done their full regimen, so their 2 doses and their 2 weeks, would need to monitor for symptoms, but they would not necessarily need to quarantine after international travel. Obviously, if they develop any of those symptoms, they would need to isolate immediately and seek testing.
Okay, and another one is, do you have a timeline for bringing back family-style dining, use of Play-Doh, sensory tables, water play for childcare?
I wish I had this crystal ball where I could. I do know that we've come up with some strategies for some of those sensory play. So instead of using sensory tables, we've seen people use sensory buckets where they might have Play-Doh or sand with children's individual names labeled on it, and only that child would be allowed to play with that sensory item. So instead of having a table where everybody kind of congregates, they all have their own little bucket.
So far, those are the only questions.
Okay, well, if you have any additional questions, please reach out, and we will go ahead and forward those questions to Skylar or Tri-County and get those answers back to you all. Oh, here's some more questions coming in.
Yep. So what if an older child in elementary school is sent home to quarantine? Do the preschool siblings have to quarantine as well?
So the answer is no. As long as that older child does not get any symptoms or test positive. As soon as they have symptoms or test positive, then that preschool sibling would need to go home and they would need to quarantine.
And when will health inspectors be back in the field?
Excellent question. We are having ongoing discussions about this and how this looks like. If we have a facility that we have major concerns about, we will stop by. At this point in time, we're still trying to figure out where that tipping point is for getting our inspectors kind of off of COVID response and back into more of their routine work. So we're trying to figure out where that will land.
And another one, do you have suggestions for responding to parents when they are asked, when they ask if our staff is vaccinated?
That's an excellent question. Off the top of my head, I can't really say that I have a suggestion, more along the lines of, you know, that is private health information. This is not something that I'm required to share with you. This is, you know, this is my body, and I made that decision. Other than that, I haven't really thought that one through quite yet. Sorry, Crystal.
It's all right. I was hoping you had more answers than I've already, replied with.
I'm just curious, are a lot of people receiving that type of question? Is that something that you would like more support around?
I'm getting more questions around, are they vaccinated? Am I going to require the vaccination? What if they refuse the vaccination? And that's kind of where it's hard because, Colorado is an at-will state. So there's just so many ways around it between, can I terminate if they don't want to get the vaccine? Do I have to require them to? It's a lot of legal questions, and I'm just not, it's a uncomfortable question right now.
All right, well, thank you for letting us know. I can bring this back to my team and maybe we can discuss some, maybe a little bit stronger talking points to kind of help support you.
And then another one did want to know, when will licensing specialists be allowed in our childcare homes to do inspections?
This is Brenda. I can answer that. The state is definitely, just like the health department, working on a plan of getting the licensing specialists back into the field. But if there are concerns, high severity injuries, complaints, county investigations, the specialists are doing site visits. But we hope soon.
And that is all the questions so far.
Thank you, Brenda, for answering that question.
You're welcome.
Okay, well, thank you for all attending. Holly, did we get the Google Doc figured out?
Yes, actually Reka created a new one. So she did put it into the chat box. If you have not had a chance to fill it in, if you could please click on the last link that was sent by Reka, we would really appreciate it so that it helps us get the correct spelling of your name for your certificate.
This is Gretchen Davidson. I just wanted to let you guys know that I did just put in the link for the EEOC around the employers can mandate COVID-19 vaccinations. It's a pretty good article from the National Law Review.
Thank you, Gretchen.
Mm-hmm.
That should be helpful for some of our providers and directors.
It's still pretty gray.
Mm-hmm.
But it does talk about, as an employer, what you can do. It's just that it goes on to kind of say each state is different and some of the things you've already expressed, but it helped me. So I thought I'd pass it on. There's the name. I just put in the name of the article.
Okay, thank you. Yeah. Okay, so we're going to go ahead and do the door prize. I'm going to share the prize that is going to be won today. So it is, again, thanks to Kaplan, we have these wonderful learning materials. We have the Learn a Lot Avocados, Fine Motor Activity, and the Cuddle Doll African American Boy. So obviously this could be for your toddler classrooms. And okay, so I know there are a lot of people that did register for today that aren't here. So we'll just keep on spinning until we get on a name that is as an attendee for today's call. Good luck, everybody. Gretchen.
That's very nice, but as you know, I don't have a preschool classroom anymore. So can I donate mine, or do you just want to spin again?
I could spin it again.
Okay.
Okay. Archie. Okay, so Archie, I will be getting in contact with you so I can go ahead and deliver those. Sorry. What's going on here? There we go. Okay. Does anybody have any more questions or any information to share? All right, well, thank you, Skylar, for sharing all that informational supports for our programs and our providers. And thank you for everybody attending today and for your time. The meeting is going to get cut short today, so you have an extra 15 minutes of your day back to you. Everybody have a great day. Stay healthy and stay safe. And we look forward to seeing you next month. Bye.